Joined now by Jimmy and also Dr. Ellie Cannon. Hello, Jimmy. It must have been a bit of a shock when you found out just how much this could possibly cost you, this treatment.
Oh, it's terrible. Terrible shock.
Did you have any idea that if you lived in England that it wouldn't have cost you anything before you embarked on it?
No. No idea at all.
And there's no way you can afford the £25,000? And if you moved house, would that make a difference? Or you're not in a position to do that either?
Well, I'm in a pensioner's bungalow, so I can't move house anyway. And I'm in a lovely little place, nice neighbours and everything, so...
So what's the option? What can you do?
Well, there's nothing really we can do. All the doctor says to me was, we'll see what you're like in 6 weeks' time when we go back for treatment. And she said, we'll try you on a mild dose of chemotherapy. She said, if that's too strong, we'll put you on clinical tablets. And she said, in the meantime, while that's going on, I'm trying to make a deal with the drugs firm to try and get the tablets. Because,
Ellie, the situation is, while we all think we live in one country, in some ways, Jimmy lives in a foreign country to England, because in Wales, the Welsh Government manages healthcare. In fact, prescriptions are free in Wales where they're not in England.
Yeah. There's complete differences between the way NHS England and NHS Wales works, exactly as you've just said. You know, there's free prescriptions in Wales, we have to pay for our prescriptions in England. And the way this has happened is the government here brought in something called the Cancer Drugs Fund in 2010, which means that patients with cancer don't have to wait as other people might usually for approval for drugs from the national body NICE. Actually, what happens is their oncologist will suggest they need a drug, and then there's this big pot of money, literally, and they can have one of these drugs that are available. And that Cancer Drugs Fund does not exist in Wales.
Well, the Welsh Government said even with the introduction of the Cancer Drugs Fund, England still spends less on cancer care than we do in Wales. They also said a Cancer Drugs Fund would unfairly disadvantage many patients with serious conditions other than cancer, is not supported by all our clinicians or the general public. Jimmy, just to finish off, the Welsh people voted to have a Welsh government. Did you vote for that?
no,
So you wish it didn't exist?
I don't think it should exist.
Primarily because of your experience?
The thing is that you've got two panels of people. Who are they to decide who lives or dies?
OK, Jimmy, thanks very much indeed for coming in to talk to us. And best of
Thank
luck
you
with the
very
treatment,
much.
of course. Thanks, Ellie, too.
Thank you.